This is a difficult matter at the best of times, but in a city like Chicago or a city like New York, where people exist by being around each other and interacting with each other on a constant basis, many more times a day than any of us realized until this started to happen. How do you manage that? How do you manage that with emergency services? How do you manage it with police? How do you determine what essential services are and what they're not? Who has to stay home and what happens if they don't?
Well, we've been working and going in this direction now for about a week to 10 days. And for us, we have been looking and guided by the science and the data that our public health officials have been generating, the data analysis. And we knew that if we didn't do something fairly dramatic, like countries like Japan or Singapore or South Korea, that we were going to continue to see an upward arc of this virus with no end. And all of us have been talking about flattening the curve, bending the curve. But the bottom line is you've got to contain the spread.
Mayor, you mentioned Japan and South Korea and Singapore. The distinction there is that you did not have local authorities and state authorities sort of having ongoing disagreements with federal authorities. This does continue to be an issue because we are not getting consistent messages across the country and at different levels of government. How do you manage that with people in Chicago?
Well, look, I think we learned early on in the arc of this virus coming to the United States that, candidly, we weren't going to get a lot of help from the federal government. And if we had waited for them for direction, I don't even know where we would be. So we knew in Chicago that we had to take matters into our own hands. And luckily, we have a governor who understands that we have to be guided by the data and the science. So we've been working hand in glove, not only with the state, but also our county officials, public health, seamlessly working together to craft a set of strategies and closures that we knew were going to be important to protect the public. So we started by shutting down large-scale events. Then we closed bars and restaurants. Then we went to groups of 50. And we were just looking at the data science and really looking at the arc of this virus and knew that we had to take another big dramatic step. I mean, the truth is in Chicago over the course of this last week, because of the measures we'd already taken, this order that was entered today is not such a huge step forward, but we knew it was important not only for Chicago, but the metropolitan area and the entire state, that we were all on the same page. I agree with one of your prior participants who said this patchwork across the United States isn't really tenable. But when the federal government's not leading and we're not getting the kind of support that we need, we've got to do it at the state and local level.